An Amish man lies in a wooden bed inside a dimly lit farmhouse. He is 43 years old. His chest burns with every breath. The cough has been getting worse for weeks. There is blood now. His wife stands beside him, holding a damp cloth to his forehead. She has seen this before. Illness is not new here, but hospitals are far. Doctors are expensive, and faith. Faith is supposed to be enough. Tonight we open his file. Welcome back to the Amish Files. I'm your host, and this is case file number 11. No doctors, no help, Amish healthcare crisis. Before we begin, if you're new here, hit that subscribe button. We're uncovering the hidden truths inside Amish communities, the stories rarely told, the systems rarely questioned. And this one goes straight to life and death. Let me start with something that might surprise you. The Amish do not reject medicine completely. That's the myth. The truth is more complicated and more dangerous. They don't forbid doctors, but they delay them, avoid them, fear them, and often, by the time they finally seek help, it's already too late. Let me introduce you to a man we'll call Samuel. Samuel was a farmer in a conservative Amish settlement, strong, quiet, the kind of man who worked 12 hours a day without complaint. When he first felt pain in his stomach, he ignored it. Pain was part of life. You worked through it. Weeks passed. The pain got worse. His wife suggested calling a driver, going to a hospital, but Samuel refused. Doctors cost money. Hospitals meant exposure to the outside world, the English world. And in his community, you didn't run to doctors unless it was absolutely necessary. Instead, they tried home remedies, herbal teas, rest. Prayer. Months passed. By the time Samuel finally agreed to see a doctor, the diagnosis was advanced stomach cancer. There was nothing they could do. Samuel died 6 months later, leaving behind a wife and 6 children. This is not a rare story. In many Amish communities, medical care is seen as a last resort, not a first line of defense. Preventive care is almost non-existent. No routine checkups, no regular screenings, no early detection, and that changes everything. Let's talk about what that means in real numbers. Studies have shown that Amish populations have significantly lower rates of cancer screening compared to the general public. That means diseases like breast cancer, cervical cancer, and colon cancer are often discovered late when treatment is harder, more expensive, and less likely to succeed. And it's not just cancer. Conditions like diabetes, high blood pressure, and heart disease often go undiagnosed for years. There are no annual physicals, no lab tests, no monitoring. Your body speaks, but no one is listening. I want you to imagine something. Imagine feeling tired every day, but thinking it's just part of your workload. Imagine losing weight without trying. But assuming it's stress, imagine a small lump. Ignored because you've never been taught what it could mean. Now imagine finding out years later that it was something serious all along. Drop a comment and tell me, would you wait? Or would you go to a doctor immediately? Now let's talk about childbirth, because this is where the stakes get even higher. Many Amish women give birth at home, assisted by midwives. Some midwives are experienced. Some are not formally trained. There is no universal standard. If something goes wrong, if there's heavy bleeding, if the baby is in distress, if complications arise, the clock starts ticking. And here's the problem. Calling an ambulance isn't always immediate. Hospitals aren't always nearby. And sometimes, the decision to seek help comes too late. There are documented cases where women and infants could have survived with timely medical intervention but didn't. Not because help didn't exist, but because it wasn't reached in time. Let me tell you about a woman we'll call Esther. Esther was 28, pregnant with her 5th child. The pregnancy seemed normal. No doctor visits, no ultrasounds, just routine life. During labor, something went wrong. The baby wasn't positioned correctly. Hours passed, then more hours. The midwife tried to manage it, but the situation was beyond her skill. By the time they decided to go to the hospital, Esther had lost a dangerous amount of blood. The baby didn't survive. Esther did, but barely. She spent weeks recovering. Physically, she healed. But mentally, she never fully recovered, and in her community, there were no therapists, no counseling, just silence. And prayer? Let's talk about cost because this is another piece of the puzzle. Most Amish do not use traditional health insurance. Instead, they rely on community support systems. If someone gets sick, the community contributes financially, but that system has limits. Major surgeries, long-term treatments, cancer care. These can cost tens or hundreds of thousands of dollars. And when faced with those costs, many families delay treatment or avoid it altogether. Because survival isn't just about health, it's about money too. Now, I want to be fair. There are Amish communities that do seek medical care more readily. Some work with local doctors. Some even have arrangements with hospitals. But in more conservative groups, the pattern is clear. Delay, avoid, endure, until enduring is no longer possible. Let's talk about fear, because it's not just about money or tradition, it's about fear of the unknown. Hospitals are unfamiliar. Machines, bright lights, strangers speaking fast English. For someone raised in a closed community, it can feel overwhelming, even threatening. And when fear meets illness, hesitation grows, and hesitation can be deadly. Here's my honest take. The Amish value simplicity, faith, and community, and those values create strong, tight-knit lives. But when it comes to healthcare, those same values can become barriers, because illness doesn't care about tradition. Disease doesn't respect belief systems, and the human body needs care, not just when it's breaking, but before. I'm not saying the Amish should abandon their way of life. What I'm saying is this: access to basic healthcare checkups, screenings, emergency care is not a luxury, it's survival. A child deserves a diagnosis before it's too late. A mother deserves help before she bleeds out. A father deserves a chance to fight a disease before it reaches the final stage. If you're watching this right now, I want you to think about your own life. When was your last checkup? When was your last test? What symptoms have you been ignoring? Because here's the truth: the difference between early and late is often the difference between life and death. If this story moved you, here's what I need you to do. First, hit that subscribe button. We're continuing this series with more case files, real stories, real systems, real consequences. Second, like this video. It helps push these stories into the light. Third, leave a comment. Do you think avoiding modern medicine is a personal choice or a hidden risk? I read every comment, and one more thing: share this with someone you care about, because awareness can save lives. The Amish Files is an independent documentary series created for educational purposes. Stories are based on research, documented patterns, and personal accounts. Viewer discretion is advised. Case file number 11 is now closed.